Over the next few months, we'll be doing some programs focused on our military veterans and veterans' mental health. On this program, we'll learn about the Wounded Warrior Project and its Warrior Care Network, which helps veterans make the transition from the military to civilian life. For those suffering from post-traumatic stress disorder or traumatic brain injury, the transition is especially difficult. Let's meet retired Lieutenant Colonel Michael Richardson. Colonel Richardson, the project, Wounded Warrior Project. Tell us a little bit about the history, a little bit about the background.
Sure. Well, I've been at Wounded Warrior Project now for almost 8 years, and it's just an amazing organization. The mission's amazing. It started in 2003, where a number of veterans and non-veterans were seeing the servicemen and women returning from overseas, from in particular Iraq and Afghanistan, and saying, wow, we need to do something for this group of veterans, unlike what happened with our Vietnam veteran who were returning home. And so they got together and they were meeting the veterans bedside at Walter Reed Army Medical Center, Balboa in San Diego, some of the VA centers, and providing comfort items. Because when you come from what they call downrange, from Iraq or Afghanistan, right off the combat field, and you get evacuated through the evacuation process, you often arrive back in the United States with nothing. And so Wounded Warrior Project, the team, they started with again, comfort items, backpacks with clothes, shorts, back then, you know, the Walkmans, socks, things like that. So when they woke up, they had some sense of normalcy. And that's where it started. Was in 2003, and it has grown exponentially over the years to providing a very comprehensive effort to meet the warriors where they are, both mental, physical, financial, social connectedness, all the above. And so it's really grown over the years and continues to rise.
Wow. First of all, thank you for your service. I know that you were out there in various postings. Do we know how many veterans there are in America, total number of veterans?
Sure. Well, the Census Bureau and the VA says there's about 18 million total veterans.
Okay.
And a good 4 or 5 million post 9/11. Since 9/11, which again this year, September 11th, will be the 20th anniversary. It's tough to say, but from that 9/11, which spawned this global war on terror, which we're still currently in.
We're in a war right now.
Yes,
I think we lose sight of that a little bit, don't we? Talk a little bit about that to bring it home to Americans.
Yeah, and so, like I said, we have been at war going on 20 years, continuous war, and many times, two war fronts at the same time, Iraq and Afghanistan. Now, the numbers have dwindled quite substantially from when I was last in Iraq in 2008, which was the surge. That's when we had the highest level of troops in Iraq, and then shortly thereafter in Afghanistan. But we still have forces in harm's way, not just in Iraq and Afghanistan, but all over the world, doing our nation's bidding, and making sure that we have the livelihood that we do, and the safety and security. And so that's still happening. And servicemen and women are still being injured, both in combat, other types of operations, as well as training. And when they come back, they need the help and services from the VA, the government, but it takes us all. And so that's where Wounded Warrior Project steps in to fill some of those gaps.
The transition from life in the military to life as a civilian must be very difficult on a number of levels. Can you talk a little bit about that?
Sure. Well, I lived it myself, as did my wife, is also a retired military officer. And so she did 23 years. I joined at 17, retired 32 years later. And sure, you're going from a very close-knit, group of teammates, your fellow soldiers and servicemen and women, who really have each other's back, especially as you're training and going to harm's way. It's hard to equate anything in the civilian life that I've experienced from what I have in combat, as well as many other servicemen and women. And then when you come back home and you transition, yeah, it's tough. You're now going from that kind of group mentality, mission bigger than yourself, to more individualistic. When you have a tribe mentality where you're really connected to and depending on your brothers and sisters. It is different in the civilian sector. And not only that, you can also have some challenges with what you've experienced. Now, post-traumatic stress disorder, traumatic brain injury is not a veteran-only issue. Of course, it's in the civilian sector, but it is exacerbated by the continuous challenges that our warriors face, especially in combat, because it's every day. The constant mortar bombardments, the constant uncertainty, trauma upon trauma. So when you come home, it is exacerbated. So there's a big difference that our first responders deal with that on a daily basis as well. Police, fire, EMS, et cetera, very similar. And so they have some very similar shared experiences as our military combat veterans as well.
So when you're in the military, you have a sense of purpose, you have a sense of being part of a team, and then all of a sudden you're kind of alone. Huh? You said individual, but you're kind of alone, huh?
You can definitely feel that way. And that's why it's imperative that communities really engage with the veterans and bring them in, because the life experiences, I guess I could say, veterans bring a lot to the table in leadership and experiences, and it's a matter of staying connected. Sadly, what we do see, though, oftentimes those that are suffering from post-traumatic stress, anxiety, depression, isolate. When they get back home and they don't engage, because, well, post-traumatic stress disorder is a disease of avoidance. So you're trying to avoid that. And what we're trying to do is make sure that our warriors and their families remained thoroughly engaged in what's going on in the community, with peer groups, things along those lines, so that, as you mentioned, purpose. They have a mission, a sense of purpose, a sense of to strive and not only survive, but really thrive in their community.
And there's also structure, right? There's
absolutely structure. There is no doubt about structure within the military. And when you leave that, obviously, there's oftentimes not that kind of structure in the civilian sector.
Do we know how many folks come out of a combat deployment who are suffering from PTSD or traumatic brain injury?
Well, the numbers vary depending on research, but RAND has done a number of research projects, and they estimate between 11 and 20% are suffering from post-traumatic stress disorder, and upwards of 40% from traumatic brain injury. Now, not every traumatic brain injury, many concussions we recover from. So if you look at the numbers, we've had about 3 million or so servicemen and women that have deployed, multiple times. And so you figure the number is upwards of 400 to 600,000.
Wow. And this Warrior Care Network, let's talk about that and how it services veterans with PTSD or TBI.
Sure. So our Warrior Care Network is one program within Wounded Warrior Project, what we call our mental health continuum of support. So we have a number of programs to meet warriors and families where they are in their journey of recovery. Our Warrior Care Network started about 6 years ago. Wounded Warrior Project knew we had to do something different. We wanted to develop an innovative model of mental health care. And so we looked to 4 academic medical centers, UCLA, we're going to talk to Dr. Joe in a minute, from Operation Mend, Emory University, Massachusetts General Hospital, and Rush University in Chicago. And Emory's in Atlanta, and Massachusetts General Hospital is in Boston. And so we partnered with these 4 academic medical centers. We asked them to set up an intensive outpatient programming, which means as opposed to 2 to 3 weeks in residence. So we fly a cohort of warriors, between 10 and 15 warriors, and they arrive to those locations and they go through 2 to 3 weeks of care. But it's anchored in evidence-based, either prolonged exposure, cognitive processing therapy, but then it's surrounded by comprehensive and complementary therapies as well. Yoga, Tai Chi, equine therapy, et cetera. So they get about 70 hours of therapy in that 2 to 3 weeks. That's a year-long or a life amount of therapy in 2 to 3 weeks. And so they each establish that 2 to 3 week intensive outpatient programming. But it's much more than that. We're also sharing data. We're sharing lessons learned. We meet constantly. Every month, the executive steering committee gets together to talk about generative discussions. What are we doing? What are we seeing? What are our outcomes so that we can really deliver the best care possible to these warriors and their families?
Treatment works, huh?
Treatment absolutely works, but not the same treatment works the same for everyone. And so that's why we bring this multifaceted approach to mental health care. It's really dynamic. Our outcomes in our Warrior Care Network are off the charts. We have over a 90% completion rate. So in the last 4 or 5 years, we've served almost a little over 2,500 warriors in our intensive outpatient program. 90% completion rate. Typically it's 30 to 40%.
Sure.
Which means you have a 60 to 70% dropout rate. We have over a 90% completion rate. That's how we know treatment works. And clinically speaking, our warriors are coming in on average at the severe level of post-traumatic stress. When they leave at that 2 to 3 weeks, they're at the minimal. And it's sustained. We track them for a whole year of what's going on with them. And then we also get them into our other programs. That's the great thing too. Wounded Warrior Project's physical health and wellness programs, our financial wellness programs, our social connectedness programs, we get them back into the fold when they go back home as well.
Wow. The thing that I liked was these 4 medical centers working together. Usually medical centers are competitive, so these 4 are working together to come up with best treatment, best practices, best therapies, huh?
That's exactly right. That's what really makes it special. One of the things, and Dr. Joe may say this because she says it, she has said it often, Wounded Warrior Project demanded collaboration. We said, if you're going to be part of this, and you have to collaborate. And that, we've done research together between all 4 academic centers with Wounded Warrior Project as well, published our outcomes. It really is amazing. And that's what's different. So Wounded Warrior Project, we are the primary funder of the care, because one thing to really note is all of this care, all of our programs are at no cost to the warriors or the families. They don't pay a penny because they paid their dues in service to our country and on the battlefield, to include flying to the active medical centers, the lodging, the food, all the treatment. That's no cost out of pocket to our warriors and their family members. All about breaking down barriers to care, and increasing access to that care. And yeah, in the academic medical centers, we've become like a family. It is really amazing the work we've done together. In
one of the things that I read, one of the warriors who has been through the care network, the Warrior Care Network, says, it just changed my life. It just changed my life. Thank you, Colonel Michael, for visiting with us today. And we're going to kind of segue and talk with Dr. Joe at UCLA. And then later on another program, we'll start talking with some of the veterans who have been through the program. So thank you very much,
awesome.
Colonel. Thank you.
Thank you very much for having me and really telling the story. It's so important.
Thank you. Underwriting for This Is America and the World is made possible by the Japan-America Society of Washington, D.C., featuring the 29th National Japan Bowl, a Japanese language and culture competition, streaming live April 9th, 2021. The National Association for Children of Addiction. Faces and Voices of Recovery. The Forerunner Foundation. The Rotondaro Family Trust. The Sultanate of Oman. The Kingdom of Morocco. And the Embassy Series, Uniting People Through Musical Diplomacy. The Warrior Care Network is made up of 4 medical facilities. Home base at Massachusetts General Hospital in Boston. The Red Sox Foundation is a sponsor. Road Home at Rush University Medical Center in Chicago. Emory Healthcare Veterans Program in Atlanta. And Operation Mend at UCLA Health in Los Angeles. Dr. Joe Sornborger explains. Dr. Joe, good to be with you this afternoon. Thank you for joining us.
Appreciate it. Thank you.
Tell us a little bit about Operation Mend and how it's connected to the Wounded Warrior Project.
Operation Mend at UCLA started in 2007, and it was really a brainchild of the Katz family. And they really wanted to help post 9/11 warriors with physical injuries. Fast forward to 2015, and we helped, tremendous amount of warriors with physical injuries. But we also saw that along the way, that families were really suffering, both psychologically and physically. And we didn't really, at that point, have the resources to support the psychological health from a treatment perspective. Wounded Warrior Project reached out to us and said that they recognized, especially from their warrior reporting, that there was a great need for psychological health for warriors in partnership with the VA and other actually mental health providers. So they reached out to Operation Mend as well as 3 other academic medical centers to see if we could form a network and what that might look like in treating moderate to severe post-traumatic stress and mild traumatic brain injury. Mm-hmm. And we all got together in an incredibly cohesive environment, meshed amazingly well, considering these were and are 4 academic research facilities, and developed the Warrior Care Network with the goal of reducing barriers to care for warriors and families and addressing the symptoms of post-traumatic stress and traumatic brain injury. And we did a lot of research, and we came up with the model of an intensive outpatient program. At UCLA, we call that an intensive treatment program.
So we have 4 major hospital centers, medical centers, Los Angeles, which is you, Massachusetts, Chicago, and Atlanta, working together, forming this Warrior Care Network. You talk about the physical injury, of course, but there are invisible wounds of war, huh? And that's when we're talking about post-traumatic stress disorder and traumatic brain injury.
Yes, that's correct. We call it the invisible wound because so often it doesn't go unnoticed, but it goes unnoticed in the civilian community. And there's a lot of stigma around warriors with mental health issues. It also gets a bit confusing because our warriors that have physical injuries also have some symptoms related to post-traumatic stress. So teasing that apart and looking at where do we get care for these specific injuries rather than looking at the holistic piece of what the warrior needs. And that's one of the unique parts about Operation Mend is that we look at both the physical injury as well as the psychological injury, which is that invisible wound.
When we talk about PTSD and veterans, people kind of associate maybe the two together, but PTSD is not a veteran thing. It's an everything. It's everybody who may have come into a traumatic situation.
That's correct, and including children. So it transcends all ages and generations. The thing about trauma is we use that word, traumatic and trauma, almost as part of our vernacular. But it really is associated with a life-threatening, either direct or indirect experience. And what I mean by that is that you can witness a loved one or family member or a close friend that is in a life-threatening situation, and that can actually fall under the category of diagnosable trauma, as well as a life-threatening situation for oneself.
So it could be anything from violence on the street to an automobile accident of some kind, or something way back when you were a child that can trigger this reaction in present day. What are the causes the symptoms, I guess we should take a look at, of PTSD.
So the mental health community put together a diagnosis of post-traumatic stress disorder. Actually, since 1980, it's evolved, and as of 2012, with the diagnostic manual number 5, actually, it is considered, there are 4 major clusters of symptoms. Mm-hmm. So you can have post-traumatic stress after a trauma, but not necessarily fall into the category of post-traumatic stress disorder. It really depends on the number of symptoms in those 4 clusters, mm-hmm. as well as how impaired you are based on those symptoms. So what post-traumatic stress disorder looks like with our veteran population, it's intrusive thoughts, which is flashbacks and nightmares, avoidance. I don't want to think about what happened to me. I don't want to remember what happened to me. And one of the challenges with that cluster is that, as you can imagine, going into treatment, by definition, you would be thinking about and examining the traumatic event. The other 2 clusters have to do with feelings and beliefs about oneself or the safety of their world, which would be negative thinking, lots of blame, feelings of shame, as well as physical reactions of hyperarousal, hyperactivity, being triggered, irritable, anger, lots of wide range of emotions that, as you can imagine, really get one stuck in a very specific response to their world around them. And when it comes to family functioning and the resources in a family, oftentimes that individual with PTSD requires a lot of managing in a family. And so creating a lot of dysfunction. For instance, if there's avoidance or there's numbing, there's anger and irritability, and that person is triggered frequently because of their environment, the rest of the family needs to help manage those symptoms.
Mm. So it's a family problem or a family illness as well, huh?
It is very much so. You know, one of the unique things about Operation Mend is that we treat the whole family. Mm-hmm. And in our intensive treatment program, we have caregivers participate 100% as patients. Because one of the things over the years that we learned with our physical injury patients is that when a patient has treatment and they come to UCLA, they still have to go home. So when they get home, they have to reintegrate in the family. And so if we're teaching our warriors to manage their symptoms and reduce their symptoms, explore their trauma, but when they go home, the family dynamic remains the same, that's problematic. We partner very significantly with not only the VA, but also other local mental health providers, so the warrior and the caregiver have that support when they go home. So there's continuity of care and continued care for 3, 6, and 12 months post-treatment.
We're at the end of our time, Doctor, but I just want to kind of lob this over the net to you. Sometimes it's difficult for any human being to ask for help, but the bottom line is that treatment works, huh?
That's the bottom line. And each one of us has a website, and on the website, it provides testimony from the warriors and family members that have gone through. But what is very consistent that's said at Operation Mend and across the other academic medical centers is that this is a life-saving and life-changing treatment program. That what we provide is care, and so often our warriors haven't experienced that level of comprehensive care.
Thank you, Doctor, for being with us and educating us This has been grand, and we should underline for the folks at home, the Warrior Care Network, just doing some absolutely amazing work. And I know you're clinical director out there, Doctor, and we thank you so much for your contribution to helping wounded warriors get well. Thank you, Doctor.
Thank you so much. I really appreciate the opportunity.
Thank you. If you are in crisis or know someone who is, these resources offer immediate help. For information about This Is America and the World, visit our website, ThisIsAmerica.net, or our YouTube channel, This Is America TV, and follow us on Facebook and Twitter. Underwriting for This Is America and the World is made possible by the Japan-America Society of Washington, D.C., featuring the 29th National Japan Bowl, a Japanese language and culture competition, streaming live April 9th, 2021. The National Association for Children of Addiction. Faces and Voices of Recovery. The Forerunner Foundation. The Rotondaro Family Trust. The Sultanate of Oman. The Kingdom of Morocco. And the Embassy Series, Uniting People Through Musical Diplomacy.